Welcome to Healthy Talk with BCH, empowering your wellness one conversation at a time. Today's episode, we're shining a spotlight on a part of our body that often gets overlooked, our feet. April is Foot Health Awareness Month, and to help us walk through this topic, we have a very special guest, Dr. John Erickson, Doctor of Podiatric Medicine here at Boone County Hospital. Dr. Erickson, welcome to the show.
Thank you so much for having me.
Could you tell us a little bit more about yourself and what a Doctor of Podiatric Medicine does?
Absolutely. So I have been working here at Boone County Hospital for almost 8 years now. I'm happily married, have 4 amazing kids at home, and just have absolutely loved being here and helping serve this community ever since I got out of residency. So it's been a fantastic spot. Podiatry as a whole is the treatment of everything essentially below the knee. So a lot of times people kind of boil that down to just being like a nails and calluses thing, and that couldn't be further from the truth. We do so much involving lower extremity injuries, pain, and all kinds of different concerns that can cause people to have trouble with their feet and with their ankles and
all that stuff.
All of that stuff.
This is my last pun, I promise. But...
You can do as many puns as you want.
Let's jump in with both feet.
Yes.
Why is foot health so important, and why do you think it gets overlooked or doesn't get the attention it deserves?
So it gets overlooked, I think, for several reasons. It depends on the patient. So much of this is patient specific, but it can get overlooked just because, for aches and pains, for most of our lives as adults and even for kids, you're told just ignore it, push through, muscle through it, it'll be fine. And then eventually it's not fine and it's getting worse. And so sometimes it's something as simple as that. Other times it can be out of fear. Some people have had history of bad things happen to their feet, and sometimes it's easier to just ignore the problem than to address it because they know what that can mean. And so for our diabetic patients in particular, we have a lot of those conversations where we're trying to dismantle fear and just encourage people to address the concern as early in the process as possible. And that goes for diabetes issues, it goes for injuries, general aches and pains, all of that stuff gets so much better the faster that we address it and if we don't ignore it. So I think that's a part of it. Part of it is also it's like, it's just your foot, it's your toe, get over
not
it.
My
it's
heart.
Just, that's right. It's a long ways from the heart. And so that can be a very real piece of the puzzle too. These things matter. We take, on average, 10,000 steps a day. And as you're going up and down the stairs, your ankle joint in particular takes about 5 times your body weight as far as force through the ankle joint itself. So if something's not working right, there's not a lot of margin for error. And there's a lot of ways that things can go wrong. And it impacts people's lives. You can be scared that something is going to hurt. So then you start to modify your activities, start to not be as healthy as you want to be. You're not able to be as active as you want to be because your foot's hurting. And then other things start to spiral. Walking is such an important part of life. It's such an important part of our general health that when you can't do that well, it really, really matters. Not to mention the people that work on their feet all day, every day. It can impact your livelihood too.
What are some common foot problems that you see in your practice, and what are their potential impacts on their overall health?
We treat a lot of things in foot and ankle, and this is part of what drew me to podiatry. It seems like it's hyper-focused on one part of the body, which it is, but we get to treat everything from, skin lesions to ingrown toenails to broken ankles, or can do really involved surgeries, and we can do a lot of really good conservative care to help get people better. Our most common patients can be general aches and pains, right? Like I don't know what's wrong, but I can't get over this thing that's not allowing me to do what I want to do. And we can dig into that and figure out what the cause is and a whole structure of things that we can do in order to get people over that and get them better and help them to reach their goals. That could include surgery. Our goal is to have it not. If it doesn't have to take the setback of surgery or the risk of surgery, then hopefully we can get better without it. But yeah, so it can go everywhere from sports injuries, aches and pains. It can go ingrown toenails. It can go painful calluses and diabetic wound complications. And we do a lot of preventative stuff too. So it really does run the gamut.
Everybody now who's listening is thinking about their foot health. What are some signs and symptoms that they need to watch out for?
Again, very patient specific, right? So the diabetic patients, you don't get to have the same things that you're watching for because aches and pains, that'll be a late symptom, not an early symptom. We want to catch things early. And so for our diabetic patients, look at your feet every day. When you shower, go into bed at night, just give it a quick look over, make sure that the spaces between the toes are fine, that there's no areas of irritation, that there's no redness, nothing is rubbing or out of place. Those simple things can go a long ways towards helping small issues get caught early before they turn into big issues. Wearing white socks seems ridiculously silly, but I talk about this all the time because it's really hard to ignore blood or drainage on a sock when it's a white sock. There's nothing wrong with black dye. I don't care if that gets on your skin. That's not the issue. The issue is that it's very hard to see those types of things if your socks have pigment on them. So a white sock can go a long way for those diabetic patients too. Very simple. but we've got a lot of things early in the process just for that reason alone. As far as, our more active patients, or maybe patients that are trying to become more active, listen to those aches and pains. Don't just muscle through them. Don't just press through them. But if something doesn't feel right and it isn't getting better or if it's getting worse, be seen early. Hopefully it's just as simple as shoe recommendations or changing an orthotic or doing some different home exercise program stuff. And we don't get to the area where it's a stress fracture and we have to have you off of your foot for a couple of months, because that's a big setback and nobody has time for that.
Do you have any other tips for everyday maintaining good, healthy feet?
Wearing the right shoe for the right activity. I'm not a stickler. I wear flip-flops. If ladies want to wear high heels...
That was my next question.
Hey,
high heels, yeah.
If it's not causing pain, then it's probably okay. But you have to be realistic with yourself. So like jamming your foot into something that clearly isn't made well for your foot isn't going to serve you well long-term. Is it worth it? That's a judgment call for whoever's putting it on their foot, right? But as a general rule, wear the right shoes for the right activity. You don't want to go wearing the Old Navy flip-flop, not to throw Old Navy under the bus, but the cheap little thin flip-flops. You don't want to wear those to the state fair, right? You're going to be putting in some miles and some steps. You want to wear something that's supportive for that. That's true for middle schoolers and it's true for geriatric patients. It's true for diabetics and athletes. Wear the right shoe for the right activity. It's going to mean something different for each of those people. Diabetic patients, if you don't have good sensation to your feet, then you should be wearing diabetic shoes with a custom insert that's specifically made to cradle that foot and make sure there aren't any abnormal pressure spots. That would be completely overkill for someone that's sensate, right? And so right shoe for the right activity is the simplest answer.
What advice do you have for athletes or people who like to have an active lifestyle in terms of choosing shoes for those sports?
Choosing shoes for specific sports and specific feet is pretty challenging. And a big piece of that puzzle is because the shoe industry morphs itself into something different. It seems like every quarter. Maybe it's not quite that often, but it sure feels like it. To where I have made a long, detailed list of, for this type of foot, you need this specific shoe out of these brands. It'll help to give people some clarity as far as what shoes they should look for. But then all of those shoes change. And it doesn't take long for that list to be obsolete. And so my most common recommendation for people is to go someplace where they know what they're selling you, especially for athletes. There are a lot of really good shoe shops in the area that are specifically running and athlete based, where they'll do a good foot exam, they'll do a good gait analysis. They know not only what they're looking at as far as your foot goes, but they know which shoes are available in the market today, and they can get them on your feet. Now that is going to change from time to time, but they are worth their weight in gold. They know what they're doing, and they're going to take good care of their customers. And so that's probably my largest recommendation as far as shoes go. Obviously, stretching and strengthening stuff is never understated. We always have to talk about the fact that injuries happen because people aren't properly warmed up, at least injuries in athletes, because people aren't warmed up appropriately, and that can start to cause some issues as well.
So we talked about what to look for, but how can we daily take care of our feet?
A lot of it comes down to basic hygiene stuff. So as long as you're trimming your nails appropriately, that takes care of a lot of ingrown stuff. The old adage everybody has always heard from that is, cut them straight across, but then you have those stupid corners that catch on socks and they hurt and they dig into the other toes. Follow the curvature of the toe. Don't chase it back into the meat of the toe. And things like that can be really helpful. Moisturizer, especially in Iowa winters, feet dry out and calluses get harder as they get more dry, and that can cause a lot of pain and a lot of issues.
How about people with odor or sweaty feet?
Yeah, so to go to the sweaty feet thing, hyperhidrosis is a real thing. I think there's a lot of shame around that where people are like, nah, that's just disgusting and there's something wrong with me. There's nothing wrong with you. That's okay. Hyperhidrosis is a medical condition where you just sweat more than what's normal. And typically that affects the palms of your hands and the soles of your feet more than other parts of the body. There are ways to treat it. Yes, hygiene's good. The one thing that's frequently overlooked is treating your shoes, finding some way to dry out the shoes and disinfect the inside of the shoes.
I've seen people do like baby powder.
Absolutely. Yeah, there are all kinds of foot powders out there. But there are also antiperspirants that are specifically designed for the thick skin that encompasses the bottom of the feet. So some of those need to be prescribed, some of them are over the counter, but they work similar to the antiperspirant that's in a lot of people's deodorants that they use in their armpits. Maybe don't put deodorant from your armpit on your foot, but there are things that are available to help decrease the amount that you sweat, and that can go a long ways towards improving life too.
I don't know if people think about this when you exercise. Are there exercises that you can do to help your foot?
Absolutely. Hypermobility, just in general, can cause a lot of problems. And one of the best ways to fight that is by doing really basic exercises, like balance exercises. The most common exercise I give people to do in the office, almost regardless of age, is just to stand on one foot and see how long you can make it. Because there are a lot of accessory muscles that help stabilize the joints in the hind foot and the ankle that don't get worked out well unless you're intentional about working them out. And so helping those tendons to work in tandem with each other and hold the foot in the appropriate orientation and structure can go a long ways. Doing single leg heel lifts or single leg squats then takes it up a step, where then we will be able to help to strengthen your core more. And anything that we do to help with stability and strengthening of the core and the legs will help your foot health significantly too.
What about lifestyle and diet? Do they play a role in foot health?
Without a doubt. We talked about how your body weight goes through your ankle joint almost as a factor of 5. Almost 5 times your body weight in terms of force goes through that ankle joint as you're walking. So for every 20 pounds that you are carrying that you shouldn't be carrying, that's an extra 100 pounds of force that's going through that joint that shouldn't be. And a lot of times we can deal with that. The bones and the structures of the feet are incredibly resilient and incredibly strong, but they're not incredibly large. And so some of these things, you can start to develop a lot more aches and pains and a lot more fractures. You're definitely prone to a lot more injuries, the higher up in the BMI scale that we get. And it makes it harder to recover from those things. If you have to be non-weight bearing for a while on one of your legs, and then we have to have you on crutches or on a knee scooter or whatever the case is, all of those interventions get harder the further down that road we go. So it definitely plays a role. And it's a double-edged sword, because if your feet hurt, it's really, really hard to lose that weight. Mm-hmm. So having very frank conversations with patients about, okay, how are we going to achieve this goal together? Because the most common way that people know to lose weight and exercise, the lowest step that they can comprehend most of the time is walking.
Yeah.
Right? I just want to go out and walk. But if I walk a mile, my foot feels like it's going to explode. Now what do? You have to find no impact or low impact options. A stationary bike can be great. Ellipticals can be really good. Swimming is fantastic. Some of these require you to go to a gym, which for a lot of folks are like, I don't feel comfortable with that. I don't want to do that. I don't want to be seen there. And so overcoming kind of that level of shame, and I'll tell you, my experience here in Boone County has been fantastic, where the gyms, the people that go there will applaud you, right? They want you there. They want to see you doing your best. They want you to succeed. And so that should never be a hindrance to getting people moving and finding a place that you can exercise and start to work on you.
Yeah. You've talked about diabetes a little bit, but can you talk a little more about the impact of diabetes with foot health?
Absolutely. So diabetes affects the body in innumerable ways, and 2 of those in particular really affect the lower extremity. The first is through the nervous system. So we all have heard of diabetic peripheral neuropathy, and all that means is that the nerves are no longer working the way that they're supposed to work. And that becomes incredibly important and incredibly deceiving for patients, because when you have peripheral neuropathy, you're no longer able to feel your feet the way that you used to. And it's not an all or nothing response. If it was like all of a sudden the lights are out, I think people would be alarmed and they would take it very seriously. But the brain is receiving the same signal as it was before you had peripheral neuropathy. It's just taking a lot more force to cause that same signal to reach there. So you have this false sense of security where it's like, well, I can feel my feet and they don't hurt. They're fine. But to get any pain signal takes an absurd amount of force to get to that point, and now we're causing tissue damage, now we're causing wounds, and we're causing trauma that normally would have sent you through the roof weeks ago, and now it's just finally getting to that point where it's tipped the scales. So peripheral neuropathy is certainly one of those things. It causes damage, it causes wounds. And then the second side of that is the circulatory system. When blood flow is decreased, it decreases our ability to heal wounds, it decreases our ability to fight infections, and it decreases your body's ability to circulate antibiotics to that infection. So that's a really big deal when it comes to fighting infections and healing wounds both. So yeah, healing is important, and the higher that A1C is, the harder it is to heal. We have a lot of studies. I know that our family practice docs have tighter numbers than what usually I tell patients, because we have different goals, but the studies that we have looked at for foot and ankle complications specifically, it goes through the roof if you're above an A1C of 8%. There's an exponential increase in your risk of complications. So when they say get it below 7, I say get it below 7 too. But know that that 8% number is a scary number, and a lot of times we may even cancel elective surgeries if it's starting to get above that, because it's just not worth the increased risk.
What are some signs that should prompt a visit to see a podiatrist?
If you're considering seeing a podiatrist, you should probably go see them. That's
it's
probably
in your mind,
if it's there,
just do
it's
it.
probably time. Mainly because it ties in the thing that we talked to first. It's in our nature to belittle some of these concerns.
Okay.
And so if we intervene sooner, then people will get better faster, and you're going to achieve the goals that you need to achieve faster if we jump on this thing sooner than later. The longer that you push it down the road, generally they don't go away.
If your foot hurts, everything hurts.
I think that's absolutely true. And I think people that have had foot pain would agree with that. When your foot hurts, you're no longer going to be as active as you should be, and you start to compensate for pain. And so pain will travel up the leg. It will go to the knee. It will go to the hip. It'll mess up your back. And a lot of that's because you're limping. And it might not be an evident limp, but you're making very subtle changes to how your foot's supposed to function. And it'll throw off the rest of the chain. Absolutely.
So we've talked about athletes. We've talked about diabetics. Let's talk about kids for a second.
Great.
What should parents know about foot development and common issues in kids?
Probably the most important thing for parents to keep in mind is that as the foot develops or as the child develops, their foot is going to change position throughout that development, and it follows a very predictable path from calcaneal valgus to varus. And it follows a very, very predictable path as far as how that alignment changes and how their foot structure changes. And so most of the time, if your kid looks like they have really flat feet and that they didn't seem to before, that's probably okay. The better sign for whether or not we need to worry about your kid's feet usually is, are they falling a lot, right? Are they keeping up with their friends? Are they complaining about foot pain? Those types of things really cue us in pretty well as to, is this something that we need to address? Is there something going on here that we need to have conversations about? Yeah, flat feet typically has a genetic component, especially if you're seating in kids. Sure. You're like, well, I mean, dad, grandpa, grandma, and, you know, like you go down the line, everybody had paddles for feet, and now here we are. Then we have things, okay, maybe we do start talking about orthotics. Maybe we do talk about physical therapy and some strengthening exercises to help prevent how much that flat foot will impact this child's life and now and in the future. But a lot of times, conservative is the way to go. Right.
What about kids walking on their tiptoes?
I have seen this several times. And if you type in toe walking, you're going to find a lot of interesting things on Google.
My mom says, does she walk on her toes all the time? I'm like, I don't think so. But now when my kids do, I'm like, walk on your feet.
The majority of times when I see kids coming in for toe walking, again, you look at Google and you look up toe walking, and it can be a sign of really bad stuff. So there's a reason for the fear, and that is legitimate, and that is okay. Look up things on Google. That's great. But then go and talk to your doctor about it. Most of the time when kids are doing it, they're doing it just because it's fun. It's a fun thing to do. It's a different way to walk. They're bored with walking normally. They're not having any pain. And sometimes it does take a good exam to kind of tease that out. And maybe we do need to break the habit so that you don't cause a contracture or something. But I can't imagine that would happen.
Parents are buying so many shoes because they're growing so fast. Is there anything specific that parents need to look out for when they're buying shoes for their kids?
Right shoes for the right activity. If you want to wear flip-flops because it's going to be an easy day and we're not doing much, that's great. I'm not opposed to kids running around barefoot. Obviously, make sure that they don't get any injuries and don't step on something, puncture wounds, stuff like that. But if you're going to be out being more active, then a good supportive shoe is going to go a long ways. I'm not overly convinced that the minimalistic, flat walking shoes, things like that, are the best. I don't know that they're necessarily the worst either. It just very much depends on the patient, depends on the foot. But replacing them as you need to is probably the biggest thing. Kids are hard on shoes. And they grow out of them too. Trying to keep them in a shoe longer than we should is going to cause probably more issues than what the shoe itself is going to cause.
Have you seen podiatric medicine evolve?
The practice of podiatry has evolved a ton. And a lot of that evolution happened before I started to practice, but it continues to change now. I'd say if you go back 20, 30 years from now, a lot of podiatrists were just starting to be able to do surgical procedures in the operating room. Prior to that, they were doing things either in outpatient clinics or patient surgery centers and things like that. But being able to have a more integral role in the hospital system is a newer part of the profession for sure. And our training has had a lot to do with that. And so the training has become a lot more standardized throughout the years. When I started in school, there were 2 different types of residencies that you could have gone through. By the time I got to residency, that had been condensed to just 1. So now everybody that comes out of a podiatry residency has 3 years of surgical training. That can be just forefoot training, or it can be forefoot and hindfoot training. But you still have 3 years of surgical residency as part of that training profile, where that wasn't the case. I mean, you go back, don't quote me on the numbers, I'm not much of a historian, but if you go back about 30, 40 years, there wasn't residency. It was you went to school and you learned what you could learn, and then you jumped in and you started to do things. We're even starting to now push and advocate for fellowships for a lot of our residents, and for folks that they want to take a more specialized approach to the practice, or maybe their residency didn't have all the components of what they wanted to have before they went out into practice. We have one and even a couple 2-year fellowships that are available in the profession as well. So the profession has changed a ton. And because of that, and because of the recent changes, podiatry looks a lot different depending on whose office you walk into.
Sure.
There are a lot of doctors in the state of Iowa that are non-surgical podiatrists, and they're very much an integral part of the medical community as a whole. Very important as far as prevention and treatment of a lot of foot and ankle modalities and concerns. We also have a newer generation of podiatrists that are coming that have a lot more surgical training. Both serve very important roles, and it's exciting to see where the profession is going in the future.
What are some noticeable developments in how you treat foot and ankle disorders?
Podiatry in general, especially from a conservative standpoint, has been around for ever and ever. And they have a lot of really good thought leaders that have developed a lot of our treatment algorithms that haven't really changed much. And that isn't because they haven't been looked at and they're just accepted as gold. It's because it works. And when we do more studies to confirm that things are working, they still prove to be good. So some areas of practice change all the time, and other areas don't really change much because the overall structure of the foot hasn't really changed much. Where things have changed, I think a lot of it has to do with the wound clinic. We have a lot of scientific advances as far as how we treat wounds and how we can get wounds to heal faster, which is incredibly important when it comes to preventing infection and preventing amputation and things like that. We got to get those wounds healed quickly. And so we have really great advances as far as some of these advanced skin substitutes and types of advanced dressings to get wounds to heal more quickly. And then in the operating room, we have numerous companies anymore that are coming up with new plate designs, new screw designs, things that are going to help provide better fixation and stability for our surgical procedures. We're even starting to journey more and more into some of the minimally invasive surgeries where you can fix a bunion just through almost like needle pokes. I'm not there yet. I want to see more evidence before we really fully do that. But then also going to courses and trying to learn these techniques so that way when the time comes that we have the evidence to really rubber stamp it, then we're ready to move forward in those areas here in Boone County as well.
And Boone County Hospital is fortunate enough that we have surgery here at the hospital and the wound clinic.
Absolutely.
Looking ahead, what do you see for the future of podiatric medicine?
We're going to continue to grow, and we're going to continue to refine the way that we are improving our patients' lives, and that could look like a lot of different things. And it's going to look a lot the same too, because again, the foot doesn't change much, but interacting with these folks and figuring out what each patient needs is going to be an exciting piece of that puzzle for me in my career. We have more advances in things like total ankle replacements and some more involved surgeries as well that are always fun and cutting edge. And the more information and the more literature that we get supporting them, more likely it is that we can start to encompass those into practice too.
For you, what's the most gratifying part of being a podiatrist?
I love taking care of the patients. I got into podiatry mainly because of the balance between both surgery and having conservative care as well. So you have some patients that you get to take care of, and it's a short window of time in their life that you're involved with things because they get better and they go about their life, and their life has been impacted by the fact that we fixed this ankle or whatever the deal was. And then we also have folks that have more chronic issues and they keep coming back, and we can develop those relationships, and that is worth its weight in gold. It's so much fun to come in and be able to joke around with patients because I see them every couple of months, and we can do that together and still be able to achieve goals and have those frank conversations. We get to sit down every day and help people get over foot pain, and more than that, get their lives back on track and achieve the goals that they want to achieve. We can walk them through hard phases of life where you had that ankle fracture and things were kind of in shambles for a bit, but helping them get back on their feet, so to speak, and get back to normal life again as quickly as possible is the most rewarding part.
Do you have any advice for someone who maybe wants to enter in the field?
You have to follow somebody around, and probably multiple people. I really thought that I wanted to go into orthopedics when I was in college, and even after I graduated from college, but I decided to kind of pump the brakes for a little bit to see if that was really what I wanted to be. And after following around a couple of orthopedic surgeons. I'm like, I don't think this is it. And
Yeah.
so then I kept looking more, and I followed around podiatrists, and I'm just like, there it is. I didn't know that that's what I wanted. I didn't even really know what podiatry was at that point. I thought it was nails and calluses. But then after following this fantastic doc around, and it was only a day, I learned so much and could see the impact that it had on the patients that were there just during that one clinic day. It changed my life.
And for our listeners wanting to stay informed about foot health,
there are numerous organizations that do a fantastic job. The Iowa Podiatric Medical Society is one of those. IPMS is way easier to type in than Iowa Podiatric Medical Society. IPMS is great. The American Podiatric Medical Association, so APMA, has a huge website with lots of information. And the American College of Foot and Ankle Surgeons also does a great job. They have a separate website, and I believe APMA does too, that is just specifically for patient information. It's foothealthfacts.org. And there's so much good information there as well. And call your local podiatrist and ask some questions.
For listeners experiencing foot issues, what's the first step towards getting help?
Call the office. Here at Boone County, we try to get people in as best as we can within a week. Sometimes it's longer than that. So if you have concerns, we can get you in. And if it's an acute concern, if you're ever worried about infection, we'll get you in that day if that's what it takes. And the phone number there is 433-8500. You don't need a referral. Most insurance companies don't require that. There are probably a few outliers there. But for the most part, you don't need to have a referral. Just call the office and we'll get you in.
And people can find more information at Boone County Hospital website, boonehospital.com.
Absolutely.
As we wrap up, do you have any final thoughts or advice for our listeners during Foot Health Awareness Month?
Stay on your feet, stay active, and call as soon as you need something.
Thank you so much for joining us today, Dr. Erickson, and for the fantastic insights into foot health. It is clear that our feet deserve much more attention and care than they often receive.
Thank you so much for having me.
And our listeners, thank you for tuning in. Remember, every step you take is an opportunity to improve your foot health. Don't forget to subscribe to Healthy Talk on your favorite podcast platform to catch every episode. Until next time, stay informed, stay healthy, and keep the conversation going with Healthy Talk.